Hi, it's Dr. Centeno, and today we're going to get into a deep dive on how to strengthen, how to treat muscular instability. This is part of the Rehab Strategies video, How to Rehab from CCI Part 2. So I want you to like, comment, share, and subscribe because that's how we get this out to more patients like you. Now, this is a three-part series. This is the Rehab Strategies Part 2, and this is focusing on muscular instability and a deep dive into how to strengthen. Now, there are rehab strategies and interventions. Rehab strategies are things like exercise, physical therapy, curve correction, etc., conservative treatment. And then there are interventions like minimally invasive image-guided injections of orthobiologics or surgery. Really, where we're going to focus here is on muscular instability, and this all looks very complex. I'm going to break it down for you. So when it comes to specific strengthening, right? Now, the lowest level specific strengthening are the laser exercises that we have online. Those are both working on proprioception or position sense, as well as low-level muscular strengthening. And they start at level 1 and they go all the way to level 5. Now, if you can blow through those, then you're ready for the next level, meaning adding a load. This is no load, just simple stuff. If you can't do this, you can't progress through these exercises, or if one level seems to cause symptoms, then you got to back up. Now, we can also do deep neck flexor exercises. Those are very low-level exercises that strengthen the muscles up front, longus colli and capitis. They can also help with headaches in particular. Now, if you can tolerate these no-load exercises and you blow through those laser exercises, for example, without really a lot of symptoms, then you can move on to small load specific strengthening. And this is things like just neck range of motion with a little bit of resistance that you apply yourself, or neck range of motion device with little variable resistance bands. That's called a NECS level, NECKS level. Those are low load strengthening. Now, lowest load is just doing neck range of motion, flexion, extension, just with a little bit of applied load. And then, listen, if you can blow through all of that, you're ready for larger loads. Now, this is going to be someone who's highly functional that can tolerate these. Most of my CCI patients would not be able to tolerate these. So that's specific strengthening, large load, like a BTE MCU machine. And that's a very specific machine where you can have dial up small weights and actually have the person go through sort of a neck weight workout. Now, the one most of my patients are not going to be able to tolerate is the iron neck. You can get it online. It's got little bands there. You can turn your head around. As you can see, you can add load here. My biggest concern here is that load is not controlled. So many CCI patients are not going to tolerate an iron neck, but maybe a few can. Then we go to the concept of healing, right? If you've had muscular issues for a long period of time, so you can do dry needling of those muscular trigger points in the suboccipitals and the large muscles, etc. Suboccipitals, deep neck stabilizers, upper trap, levator scapula, those are the secondary stabilizers. Now, dry needling is something that you can really find across the country, and you can also do ultrasound-guided injections of platelet-poor plasma, platelet-rich plasma, for either of these if those muscles are having a problem, meaning you're not able to really strengthen. Maybe you need some direct muscle or tendon injections using orthobiologics. So in summary, instability comes in two types. We've covered the muscular type here. There's also ligament instability, which I'll cover as well. And remember, with all strengthening exercises, you need to thread the needle, and that means that you go slow and try to advance. If you get a lot of symptoms, you back up. If you're getting just minimal symptoms, then you can move forward. And you may need to get the muscles and tendons treated directly if you can't move forward. And if you still can't advance, you may need precise orthobiologic injections to treat the CCI. That would be things like posterior injections or PICL. But again, realize that you have to thread that needle with strengthening such that you don't really cause a huge flare-up. And if you're getting a huge flare-up, back up And if you can't do any of this without a huge flare-up, then you probably need to get stabilized from a ligament injection standpoint, treating the craniocervical instability. Thanks so much for watching. And again, like, comment, share, and subscribe, because that's how we get this out to more patients like you. Thank you.